After the roundtable discussions in 2021, MSF proposed the idea of having a patient-led CBO that would propose harm reduction services.
Having Addiction Center Kiambu is a community-based organization that was founded on 2022 October in Karori Medically Assisted Therapy Clinic. And the idea stemmed from the needs of the people who use drugs community in Kiambu County, seeing that there were no any organization that brought together people who use drugs to address their needs.
After the discussions, of course, MSF now met with patients and proposed to them the idea. There were self-help groups that had been formed by patients initially. So these 5 self-help groups evolved into a CBO. Then after that, several meetings happened with the social services department, and this was just to consult how they would register the CBO and how the social services department would come in to train the CBO. After that, then collaborations with the county for integration, and for the county also to give their input towards the formation of the CBO.
The community-based organization started with 32 individuals, which could be said to be founding members. The objectives: one was to have a safe space for people who use drugs in Kiambu County, and also to provide harm reduction services for the community. We've been able to have representation of people who use drugs in community barazas and community meetings. We've also been able to establish a working relationship with the local administration, where they always invite us to their gathering and give us a platform to speak to the community. We've also been doing community cleanups on a monthly basis, every last Saturday of the month. And through the feedback that we got from the community, we were able to sit down as an organization and come up with an initiative to have people volunteer to disperse crowds around the clinic and refer them to the empowerment center, or just inform them of how negative it impacts the clinic and us as PWDs or as people with drugs when we idle around the clinic. We have major impacts. We've been able to sensitize the community and gather support, a lot of support, at least around where we operate, the county. We've also been able to create awareness and visibility. And we have seen a lot of the community members joining in our activities. I would say that is a really major achievement and a very big impact, because previously the support was very minimal. We also at some points had a lot of resistance from the community, whereby they even opposed the medically assisted therapy clinic and said that it was not a concern of the community. They also would oppose it, saying that something else, for example, a funeral home, was more preferable instead of the clinic. And we've been able to change that. We have received a lot of capacity building, of which we really needed, which includes, among many more, data collection, data management, advocacy, communication strategies and skills. We've also, in the initial periods as the organization was being founded, we were able to receive trainings through MSF by Social Services Department of how to write constitutions, the requirements of registering a community-based organization, and also the channels to go through as we register. I would also say that we've walked a journey with MSF, whereby they've been monitoring and also assisting us with resources to be able to grow the community-based organization.
We're still looking at strengthening their governance structures, strengthening their how they define different roles and responsibilities, strengthening their monitoring and evaluation, as well as making sure that we also build their capacity on grant applications and other fundraising initiatives. In the case where there are other mechanisms that they could use to support themselves is to fundraise so that they develop that experience within themselves and they do not outsource.
The truth is we need them, knowing the gaps that are usually present in the MOH setup. Like now, the way they are able to run the empowerment center, for instance, so we realize maybe we would have had to hire someone to do that. So we feel the support. I mean, every hand you can get in MOH to be able to support is usually very positive. The collaboration now has been, like what I've mentioned, to be able to have even more meetings. To number one, understand one another even better in terms of the contribution and the integration between MOH and HAC, so that we know how best to be able to work, even in a resource-limited setting, and the autonomy that we are greatly looking forward to for HAC. Just like any organization, they have their own challenges, and one of the challenges is stigma and perception from the community. So stigma towards people who use drugs, perceptions that people have out there towards people who use drugs, you know, the myths. Sometimes they withdrawn by the family members, by the community. You know, sometimes they are labeled as thieves. Sometimes they are even arrested for no reason. So these all culminate to stigma and discrimination, which hinders their full achievement of their objectives. Another challenge that they have is a lack of funding. So currently, MSF has a defined time period up to when they will support the CBO. So they have written proposals here and there, but they have not had a funder yet.
Our future, I would say, say 5 years from now, is to see that we have a full representation of people who use drugs in Kiambu County. This is, this is only possible when we are able to access funds, which is what we are really focusing at right now.